There are two very important causes in the month of February. It's both National Heart Month and Black History Month. Heart disease is the leading cause of death in the United States. A new study out by UPMC examines racial factors in heart disease based on a person's education level. Dr. Amber Johnson joins us tonight. She is a UPMC cardiologist involved with the study, leading the study. Dr. Johnson, thank you for making time for us tonight.
Thank you for having me.
Historically, can you explain what the link is between a person's education level and their heart health?
Well, we think it has to do with resources that one has as they gain educational attainment. So as you increase your education level, you are more able to have employment, steady employment. You're also around others, colleagues who have higher levels of educational attainment and higher income. And that creates different norms of health that you may not see at lower levels of educational attainment.
So what did your study aim to find out?
Well, we wanted to see if there was an association between education and heart health, as well as if there was an association between race and heart health, and how did race and education interact with each other.
So did you find this link among all racial groups?
We did. So at increasing levels of educational attainment, the likelihood of increasing your health, your heart health increased. And that was true for all of the races that we studied. We looked at African American, white, those who are Hispanic, as well as Asian Americans.
What are some of the contributing factors that you think cause some racial groups to be more at risk in general for heart disease?
Well, interestingly, what we found in our study is that at different levels of educational attainment, race can affect the likelihood of having a heart healthy lifestyle. And things that are associated with a heart healthy lifestyle include physical activity, having a low glycohemoglobin, so less diabetes, eating a heart healthy diet. And all of those things can be linked to race and ethnicity. It may have to do with things like what you're able to do in your neighborhood, what you may have access to in terms of your ability to do physical activity and to lead a heart healthy lifestyle may have to do with your neighborhood or maybe your cultural background. And we also find that upward mobility, upward social mobility, so that increased level of educational attainment was not equitable across the different races.
So okay, yeah. Now, when it comes to someone's age and the time that they really need to be looking into this, is there a certain age, or should it just be all the time that you're invested in these things?
Well, some data have suggested that across the lifespan, a heart healthy lifestyle is important. So that's from the time that you're young, a child, leading a active life, eating a healthy diet. Those things are important from childhood all the way through older ages.
And can you just call up a heart surgeon or a cardiologist like yourself and say, hey, I want to check my heart?
You can, yes. I've seen some patients in clinic who are concerned for one reason or another. Maybe they have a family history or they've had some symptoms and they just want to get checked out. And there are some folks who haven't had any symptoms at all, but they reach a certain age and they decide that they want to get a checkout by the cardiologist, and that's fine too.
Better to check. Dr. Johnson, thank you for joining us tonight and for sharing more about the study.